Real excited to be here. Vaughn, I'd like to say special thanks for you for inviting us. We do these talks throughout the entire community, and so the talk that we're going to do tonight is very similar to us. We've been doing these for about 5-6 years now, and hopefully you guys can learn something. This is very interactive. We want to make sure we can open this up throughout the time. Don't feel like you're going to interrupt. We'll obviously open at the end for some questions. But our goal today is to kind of teach you where true health is coming from. Here recently we've teamed up with Vaughn with some of our patients and even ourselves to just get to a higher level of health in our practice. And one thing that we found is that knowledge is power. And when we understand how our body works and how it functions and how it was created to function, we have a lot more likelihood to have success with it. So when we start looking at our country today, how are we doing in overall health? Are we doing pretty good? No. In fact, out of the 36 richest countries in the world, we're last if we're industrialized countries. And are we getting better at that or getting worse? We're getting worse. Right now, Dr. Adam, I just looked a stat up today. There's 132 million prescription drugs that are written every year. And that was somewhere upwards for adults, where some people are taking 10 to 12 every year on average. And so obviously that's not going to create more health. And so with all the things that Vaughn is doing here and all the things that we are trying to do in the community, we're trying to educate and teach you guys. So we're going to first kind of start off and talk about where our health system's at today and kind of what's not working, because we kind of have to know what's not working first before we can know what to do next. So when we look at our healthcare system today, a lot of it, we think of healthy as being skinny or how we look. We look at people on the cover of a magazine. We look at people like Jace and Dr. Adam, and we think they've got to be healthy, right? Look, they're muscular, they're fit. Doesn't always work that way, right? Because when we look at the disease process in our body, it takes years and years to build. And obviously it's better if we have less fat on our body. It's better if we work out. It's better if we eat healthier. But there's one true main source where real health comes from. And Dr. Adam's really going to hit that when we get going here. First of all, I want to talk about is the 3 things that are killing us the most. Right now, what's the 3rd leading cause of death in our country? Do you guys know? No, that's not number 3. Okay. She's reading ahead, though. What's that? That's number 2. Yep. Number 3 right now is cancer. Is that getting better or worse? Right? I'm 37 years old, and when I went to school, I never grew up with anybody who had cancer. Nobody in my class had cancer. Maybe a parent or a grandparent did. But today in our school systems, we have kids that have cancer left and right. And when we look at cancer, it doesn't just start 3 weeks ago and now we have cancer today. Cancer builds for years and years and years. And then it finally shows up. And Dr. Adam will really hit on this too. Is cancer a disease or a symptom? There we go. How about this? Nice. Somebody's been teaching. So what's number 2 right now in our country? Yep, heart disease, right? And my father passed away at 59 years old of a heart attack, and all the things that he did in his life led to that problem. It wasn't because he had bad genetics. Everybody in my family has lived into their 80s and late 80s. It's all the things that he created to cause the bad things in his life. So that's why we teach a lot of the things that we do to make sure that we don't end up that way. So if you have a cancer, or you have heart disease, or you are sick, you have a headache, or you have back pain, what do we do in our country? We take a medication. And that's actually the leading cause of death in our country. It's called iatrogenic or iatrogenesis. According to the Journal of American Medical Association, right now in our country, 999,936 people die every year from the adverse effects of medication and things going wrong in a hospital. So is there a time and place for it? Absolutely. Thank God we have an emergency room close here that if I fell and my leg broke, they could save my life. If I did have a heart attack, we have the best emergency care system in the world. But when it comes to living to 90 or 100 in great health, don't go there. That's not what they're designed to do. And when we start going there, what happens? We end up with 1 pill, and about 2 years later, we're on 10. And health doesn't come from a pill. It comes from within. And, you know, I'm sure Vaughn's done a great job teaching these things and how to do that through different ways of juicing and how you eat and supplements that way. Dr. Adam and I are going to talk about it with the spinal cord and the nervous system today to make sure that component is there for you. So Dr. Adam's going to take over right now here, and he's got a little bit to read, and then I'll catch up there later.
Awesome. Thank you. I'm Dr. Adam. I'm the bald one. So whenever we're talking about Dr. Shane and myself, that's the easiest way to remember. What I want to read here really is about what health is, because we just went through and we understood what's robbing us of our health basically in the U.S. today, right? We talked about heart disease. We talked about cancer. We can continue to go on, everything from diabetes, arthritis, things that are actually hindering us from living our own life. What we have to do is then we have to figure out if those are the things that are robbing us of health, then what can we do then to actually have great health, okay? Because if we were just told what the bad things are, but then never told what we could actually do to change that, where would we be, right? And so my first question to you is, what is the definition of health? Because how many of you in this room actually want great health, right? Everybody wants great health, but do we know how to truly define it? So how can we have something which we can't even define? And so when we start to look at this, I want to read this. This actually comes from, it's called the Atlas of Life. It's actually a chiropractic philosophy blog, but what we're truly talking about here is what God has put inside of us, and it's an ability to heal. And what you can really narrow that down to is called innate intelligence, okay? It's called innate intelligence. It's what's inside of us, the 72 trillion cells within our body. They can't even vibrate unless our brain, our nervous system, our spinal cord actually tell them to. Because if you're brain dead, what happens? You're dead, right? If there's a nerve that's coming from my brain down my spinal cord and going to my heart, and I cut that nerve, what happens to the heart? It stops, right? Well, how does that truly affect our health? How does this nervous system, this innate intelligence, this ability to heal, affect how healthy we are or how healthy we aren't? And so I'm going to read this because what we need to understand is, how does our body heal? In fact, the true definition of health is what? Does anybody have an idea of what the true definition of health is? This is the part where you can talk back to me.
I don't have this worked out, but something to do with that your organs will function at the full capacity that they were meant to.
Okay. Yeah, so what she said is basically your organs, your systems function at a full capacity that they're actually meant to. And honestly, that's the definition of health. It's how our body functions. And ultimately, it's how our body heals. And so if you even think of the word health, literally just circle the first 4 letters. What is that? That's healing. So Dorland's medical dictionary actually states that true health is 100% function physically, mentally, socially, and spiritually, not just the absence of disease. So if people think that not being sick is healthy or feeling fine is healthy, they really have it backwards. Because I could stand up here and Dr. Shane could hit my hand with a hammer, and that's probably going to hurt, right? But does that mean I'm sick? No. I don't feel good. My hand hurts, but I'm not sick. And so true health is how the body heals. It's 100% function of every single organ, cell, and tissue in our body. And so I want to read this because this is really get into how do things truly heal. And so talking about this innate intelligence, everything in life has organization. It has intelligence. It could be a picnic, a multi-million-dollar company. It could be the human body. But we have to understand that a picnic needs someone to organize it. Who's bringing the sandwiches? Who's bringing the blankets? You can even think of IHOP, right? How does it function? There's people that are positioned to do certain things so that it's a well-oiled machine, right? Your body's the exact same way. But what controls that intelligence inside of us? Anybody? God, right? And what did God put inside of our body? What was the first thing that developed after 15 days after conception? What was the first thing that developed within us? Our brain, our nervous system. And it's made to control everything. For a single heartbeat to actually happen, for you to listen to the words that I say, for you to blink, for it doesn't matter what it is, for the 72 trillion cells to vibrate in your body. Your nervous system is sending a signal there. So what is health? Health is that organization. And so when I look at a chart like this is what I see when I see health. It's a brain, it's a spinal cord that's designed to send signals out to all of these different organs, to every single muscle in our body, to tell it whether to actually, for a muscle to be tight, for a muscle to be weak, for a heart to beat this many times, or for your lungs to be able to breathe. The body is constantly sending those signals. And so one of the major things that we talk about in our office is called subluxation. And subluxation is an interference within our body. It creates a dis-ease within our body that can eventually lead to disease. And so what Dr. Shane now is going to talk about is how chiropractic can actually lead to these other issues within our body, from heart disease to cancer to diabetes, and how once we can actually remove the pressure off our nervous system that's creating these issues, how our bodies can truly heal. And then we're also going to get into a little bit actually about what true corrective care is, because that is one of the things that we specialize in. I mean, most of you have probably heard of chiropractors before, right? Okay, chiropractors are the guys you go to when you have neck pain, and you go in, you get popped, right? Or cracked. I mean, there's all kinds of different definitions. I'll tell you that we aren't a soda, and we don't sell drugs on the street. So we don't do either of those things. What we do is we actually adjust the spine, and we correct the spine. It doesn't matter if it's scoliosis or a loss of these curvatures in the spine, which are creating dysfunction. And so Dr. Shane's going to actually go through, he's going to explain what subluxation is and how it affects the body.
Okay, so when we look at this, we're going to look at what normal should be first of all. When we look at the spine from the front, we want to be completely straight up and down. We don't want to see any side bending or curvature, which could be called scoliosis or towering. So this would be an example of scoliosis right there. Now, we know that scoliosis, the average person lives between 10 and 25 years less, is what the medical research shows, simply because the information that travels down the brain that goes out to the organ cells and tissues is shut off. Wherever that problem is shut off or pinched, you hear a lot of people say that, that's what true subluxation is. And what it looks like to us on an x-ray is loss of curve from the front, like that, or from the side, we're losing the curves here. So when we scale back here, you can see the lime green. Here's the face, here's the back of the head. We need a 45-degree curve in neck, mid-back, and low back. When we lose those curves, like Dr. Adam just showed there in the neck, what that does is it chokes information off starting at the brainstem. The first two vertebrae, the atlas and the axis, they touch the brainstem. And so when there's direct pressure there, we have a whole bunch of issues: insomnia, ear infections, headache, neck pain, thyroid issues, you name it, across the board there. And if we choke everything off here, dysfunction happens below there. So people always say, well, doc, I'm coming in with low back pain going down my leg. Why are you looking at my neck? Well, that's the source. We have to make sure there's no interference or subluxation in that area. So when we look at this and analyze this, it's always more than pain, okay? A lot of our patients now, when they come in, it's not about pain, it's about function, which, how many times has somebody said that? Typically, the crowd always says it's based on how we feel. And once again, it's not about how we feel, it's about function. And we look at function, we have to lose 40% of function to actually feel pain. So for your muscle to hurt, for you to have radiating pain going down your arm, for you to get a headache or low back pain, you go from 100% function all the way down to 60% function before you can feel that. So if you're looking good, you think everything's fine, your blood works fine, and you're at 61%, you're still 39% away from 100% function. And what controls all of that is that brain and the spinal cord. So that's what we look for in the body. And so when we're looking to corrective care, what's different about corrective care and why we are so passionate about it is because, long story short, I used to practice and basically just treat patients for pain. We had great success doing that. But bottom line is, it came down to is I felt like there was something more. Unfortunately, we're not taught these things in school. And when we look at corrective care, we literally now know how to change the spine over time. And we can change the spine, that truly creates a permanent change in the body. We adjust somebody for 1, 2, 3, 4, 5 visits, and the pain might go away, but it's truly not full corrective care. And so now that we know how to do this, it's a lot of fun, because that's where we see real fun cases. I believe you might have been the first person to tell us about Vaughn. Did you come to our dinner with the doc here maybe 6, 8 months ago? Funny how that works. Funny how that works. So thank you. But when we start looking into corrective care and we can change the spine, we see all these wonderful things happen that normally you wouldn't see a chiropractor for. And it's not based on chiropractic, it's based on function of the body and the nervous system being realigned so your body can heal. Things like allergies, sinuses, asthma. We see blood pressure issues that decrease because of the vertebral artery in the neck. We see people with radiating pain. We have one of your leaders here in IHOP. He's got a real serious problem right now that we're helping with. It's creating a lot of health issues in his body due to dysfunction in his neck, and he's got herniated discs. When we start taking the pressure off of there, right now with this patient, he needs to get out of pain first. But what we're worried about long term are those same nerves go to his thyroid. If we look at this chart here, this friend that you guys all know that by law I can't say who he is without his permission. He did? Okay. Well, Corey Stark, he gave us permission, so you guys all know who Corey is, and I believe a lot of you have been praying for him. These same nerves go to his thyroid. They go to his upper heart and to his lungs. So right now, our goal is to keep him out of surgery, and that's his goal too. And when we align his body the right way, it's meant to heal. It's designed to do that. And we've seen it hundreds and thousands of times, and that's what's so fun about this process is when it's measurable. Because we're all human, and we like to see changes. And we take another picture, and you can see that go on. That's really nice. So that's what we try to work on and get patients to do a lot of this stuff at home. So, Doc, I want you to add more to this. If I've missed some things on the corrective care, I kind of got off on another tangent there with Corey. Yeah. So go ahead.
That's fine. Yeah, and Corey gave us, obviously, the opportunity to be able to kind of share that with you because his biggest thing, and he always says to us, is that if I would have known that this was going on before, I would have gotten this corrected long before I was driving in the car for 10 hours and had no idea what was going on. And that's truly what it is, because we live in a society right now with our healthcare system where we're in a very reactive state, right? Isn't that true? We wait until we have cancer, then, now I'm going to change my diet, right? Or wait until we have heart disease, and now I'm going to change my diet and exercise. Whereas we need to begin to literally change and do a 180 and start saying, let's be proactive about these things, How many of you get the oil changed in your car? Right? Why do you do that? To maintenance, so the engine works, so it doesn't break down, right? How many of you are maintaining your health? Regular checkups, making sure that your body is actually functioning and healing. Again, putting the right fuel into your body through nutrition, right? That's what we're supposed to do. Our bodies are made to live 90 to 120 years old, okay? That's what they're made for. Our brain, literally, biblically and scientifically, is shown to live 120 years. 120 years. But why doesn't that happen? And to give you the basic understanding, that the last point when we said what we're going to be talking about today is how does subluxation, how does pressure on our nervous system cause things like cancer? How does it cause things like diabetes? Because that's a bold statement when I say that. And people are like, how can that actually happen? That's not what's actually happening. Because what we're taught is that, if you think about this, cancer patients, right, they have weak immune systems, right? Is that correct? That's a correct statement? Actually, the way that it truly works is that it's somebody with a weak immune system that develops cancer. See how we switch that? Because that's the truth. And so what we have to understand is that every organ in our body regenerates and it rechanges. We have new hearts, new skin cells. Every 27 days, we have new skin cells. They're literally flaking off, and we have all new skin. We all have skin, right? So it hasn't not grown back. Well, what controls that process? Anybody? It's our nervous system. And what determines whether or not we actually have those healthy cells is whether or not our nervous system can send those signals. And it's amazing, the nutrition that we put into our body creates healthier cells. Okay? And so, knowing that, we know that our body has to continually regenerate. So if our brains are made to live 120 years, how long should we be living if our body is truly functioning at 100%? 120 years, maybe longer, who knows? But who wants to live 120 years? And who knows? But we can. There's a lot to do. There's a lot of purpose that we still have. And so we should be able to live that out. And so understanding how our body functions, how it heals, is the true definition of health. And it does. It comes into all those different aspects, from the nervous system to nutrition to exercise. But we need to make sure that that system is working properly.
Yeah, and I think what's so exciting for us is, we go to any place and do a talk like this, and we'll come into a corporation with, last week I did one at M&I Bank, and there was 4 people because they were going through a conversion, and that was great. And those 4 people were actually, it probably worked out that way, God had a plan that way. There were 4 people that needed a lot of information. But if you guys are here, you're hungry for change, you're hungry for knowledge. And the things that Vaughn and the other instructors that come in here that teach you guys are things that create longevity and allow you to serve your purpose and your mission on this planet. And that's what's so fun about this whole process, is because we get to see that happen. And you take a team of us. We've always said that healthcare shouldn't be about an ego. And I learned this a long time ago from one of my coaches. Ego is just edging God out, right? It's all about me. And so when we take healthcare and put you in the middle and surround all of us, that's how it should be. And if I'm doing the right thing for you, it's not about what I can do for you. It's about what we can do for you, and ultimately what your body was already designed to do. And living in pain is not fun. Having a disease or symptoms all the time is not fun. So it's amazing, though. A lot of times the first thing that we have to teach our patients, we call it maximize mind. We have to do literally that 180 that Dr. Adam was talking about, because if you're heading this direction and you're getting really bad results and things are going bad and you've got diabetes and you're on 5 medications and high blood pressure and you had skin cancer and you name it, well, what that means is you've got to go this way, because this way is not helping. It's creating more disease. And sometimes I'm pretty stubborn. Sometimes change is not easy. And good thing is that's why we get down on our knees every day and pray, because that allows change to happen a lot faster. And we have a lot of fun doing this. Between Dr. Adam and I, I don't know, I'm guessing we see 100 patients a week just through IHOP, and a lot of wonderful people that need a lot of help. We all go through stuff in life, and there's a physical, a mental, and an emotional component to that subluxation. It's not just physical. How we think and what we do all day creates subluxation in our body too. In fact, to give you an example, where do you guys feel pain when you're stressed out? It's different for everybody. Our neck typically, right? Our upper back. Well, some people feel it low back, or they feel it in their arm, or you name it. We always say that's where your weak link is. Wherever that bubble on your tire, the stress point on the tire, wherever it shows up in your body, that's where the problem is typically. And today we're in a society where everything we do, we go forward. We're on the computer all day. We sit in classes all day. Dr. Adam and myself, we lean over all day. I know that Vaughn's sitting at a desk all day, looking at seeing patients. And so we're in a society that isn't as physically active as we need to be. We aren't doing a lot of the right things that we should be, not because we don't want to. It's just our environment that we live in. So.
Awesome. Basically, from here, what we'd like to do is actually open it up for questions. Anything that you have about chiropractic, about corrective care, about the nervous system, how it affects your body, we're just kind of open this up. Great.
I've had scoliosis for about 60 years now, and I've been in 4 car accidents, and I have 3 vertebrae fused in my neck. And my hips, I get pain that goes down both my legs every now and then. Is there something that can be done to straighten out my scoliosis at this time in my life?
Absolutely. Through the research that we've done and obviously treating patients with scoliosis, I think our oldest scoliosis patient was like 89 years old, and they're still able to be correction with that. I mean, we treat patients that have scoliosis literally from infancy to 89 years old. And so the biggest thing that I can say is that when treating scoliosis, because we get this question all the time, can you treat this or can you do this? Ultimately, it comes down to when we look at a spine to how much can be corrected. But I can tell you, even a 1-degree change in scoliosis without surgery is considered a medical miracle. And we're doing that every single day. It's about counterbalancing the spine. It's about seeing what are those bubbles, those weak points within the spine. How can you fix that? Because it's almost like a domino effect. You correct one spot and the other areas start to change. But again, radicular pain going down your legs, going down your arms, wherever it may be, I mean, that's a sign of nerve damage.
Right.
But the amazing thing is that the nervous system can heal, just like the rest of the body. And people say, well, no, that can't. You know, we have neurologists say you can't heal peripheral neuropathy, you know, unless you go into a surgery. But we have paraplegics that come into the office, and after a few visits, they actually start to get feeling in their legs again. So here's the thing. You can't put limits on God,
Right.
because he's the ultimate healer. You know, he's given us as doctors the ability to find things. And what Shane and I say is we move the bone, he does the healing. And that's ultimately what it is. So yeah, there can still be correction.
So then the scoliosis is what is affecting what they say would be my sciatic nerve?
Exactly. Yep.
Okay.
Yeah, so that, you know, and this is a real common question, and I've been in practice now for 11 years. Probably the number one thing I used to see was low back and sciatica, which is the pain going down the leg. And I think today probably the number one thing we see is headaches, neck pain, upper back pain, because of the society we live in now and just the level of stress that we have. And but you know, to complicate that scoliosis, there's probably some arthritis going on there, and the disc has got a lot of pressure on it for that to happen. And one thing that we have to understand, once again, his symptom is pain going down the leg, low back pain. Well, those same nerves, if we look at this chart here, they go to his colon, they go to reproductive organs, they go to his bladder, his prostate. Okay, so there's a host of things going on here that he can't feel yet. And maybe he does have some symptoms. We're not going to ask him those questions right now, but it's all connected that way. And what's really cool, like Dr. Adams said, you know, we've had, my wife had 20-degree scoliosis when I met her. And through the training that we've been through and being able to go through things, she's now at 8 degrees. She's got a herniated disc. Just, no, this one doesn't have a red disc on it, but her disc was herniated quite bad on MRI. And she's now at 8 degrees. If she doesn't maintain care, it comes back. And one thing that it affects on her a lot is her bladder. She has to go to the bathroom all the time if the pressure's not off that nerve, because it's directly where that nerve goes to. So typically that patient would go to their medical doctor and say, I'm peeing all the time. And my wife's low back pain was minimal at the time. That was her first symptom. And then the pain going down her leg, and then the back pain came on after that. So, yeah. Good question, Tom.
Hey, I have had chronic neck and back pain since I was about 13 years old. I'm 20 now. I'm not a very stressed out person, and I'm very active. I've been playing sports my whole life.
Sure.
But I didn't know if there were any like 180 steps that I could be taking. I've changed my diet to a lot of what Vaughn has suggested. I've been going to classes for a while. And I've been to physical therapy before, but never been able to afford chiropractics. So I didn't know if you guys had any suggestions.
Sure, yeah. First of all, the things that Vaughn teaches you guys are right down the alley. It's actually, we do teach nutrition. He just happens to be the absolute expert inside of nutrition. And so the things that he's teaching you guys are allowing your body to become as healthy as they possibly can, and to allow those ligaments, muscles, and joints to regenerate and to get the proper nutrition so you can cleanse every cell. That being said, what was your name? Alex. Alex, the average child falls 5,000 times before the age of 5. So think about how much whiplash is created to the spine when that happens. Now think about this. From there, you slip on the ice and hit your head how many times? You fall and you play sports, and a lot of us guys, we play contact sports and we get stingers going down our arms. You get in auto accidents, you do all these things. And now what happens is that net goes from this position here to this position here. Dr. Adam will show you. And you don't realize that, and you really can't see it until you take a picture. Well, what happens there is now that brainstem and the spinal cord at the beginning are compressed like we talked about when you lose the curve. So now even at 20 years old, you have aches and pains that you shouldn't have at 20 years old. You shouldn't have them at 60 years old either, okay? So your body's just in the wrong position. So there's things that you can do without having a picture, a little cervical neck roll that's very inexpensive, costs $20, or the easiest way to do that is just to roll up like a big beach towel so it's about this big and lay on it. Ice and heat is way better than the aspirin, ibuprofen, or Tylenol could be. Ice decreases the inflammation, and it takes away pain better than ibuprofen ever has been able to. It's just that you can't make any money teaching him to put ice on there, so no doctor will tell you to really do that. Yeah, so there's a lot of things. If you want to talk to us afterwards, we could help you out. Yeah.
Because one of the big misconceptions too is that you obviously, you've done physical therapy, and a lot of patients say, well, I've had scoliosis, I've done physical therapy, I still have the back pain, or the sciatic pain. And what I want to do is clarify kind of the difference between what physical therapy is and what we do. Physical therapy does a lot of stretching, muscular strength, and they're focusing on the muscles and the tendons of the body, which is phenomenal, and there's need for that. But what we're focusing on is literally the erector muscles that attach vertebra to vertebra that truly then correct the curvature of the spine. Because if you just continue to stretch and strengthen a spine without getting it curved, you're just strengthening a straight neck, or you're strengthening a scoliosis. So what's that really going to do for you? Nothing. And so there is a difference between that and corrective care chiropractic. And so, and like Shane said, and I'm going to just reiterate this, the nutrition that you're putting into your body, I'll tell you one thing, that the people that are eating healthy and eating the right foods, they're the ones that actually heal a whole lot faster than anybody else because they're already fueling those cells. They're fueling that body. And so that's one of the biggest things that we tell patients to do as soon as they start any type of corrective care is start eating right. Because if you don't, if you're getting corrective care on your spine and you're eating McDonald's every single day, what are you doing? You're literally still killing yourself from the inside out. So I just want to clarify the difference on that. Yeah.
Hello, yes. I had a question about the 45-degree angle on the spine. You hear lots of things, people say a good way to maintain your spine is to sleep without a pillow or without a cushion and just on your back. I just wanted to know if that was something true. And also as well, how we'll just crack other people's backs and do stuff like that. Is that really necessary, and is it healthy, or can it endanger us?
Yeah. I love this question. Well, first of all, sleeping without a pillow, we 100% agree with. Because it is, think about this. If we talk about, if you're on your side, first of all, we'll say sleeping on your back is the best way to sleep, number one. If you end up sleeping on your side, I can tell you can train yourself to do anything. You really can't. People say, well, I can't sleep on my back. I have to sleep on my stomach. So I say, really? You can't do that. You can do that. You can train yourself to sleep on your back, but sleeping on your back, again, it helps to level out your spine. It's not going to flatten it. In fact, we have sleeping aids where there are actual little rolls that go right behind your back here to actually just create that curvature while you rest. But think about it. If you're on your back and you put a pillow here, what does that do to your head? This. And then you put another pillow. Now you're sleeping like this. I can't even breathe doing that. So that's probably going to make you snore, have sleep apnea. You name it. It can continue to go on and on and on. If you're on your side, I do recommend putting a pillow there so that your spine stays straight this way. Okay? But yeah, sleeping on your back is the best. Do you want to take the next part? Okay.
Okay, as far as you cracking, popping, because adjustment comes through training, because it's specific to a point, and it's based on, in our office, x-rays. So what was your first name? Peter. If you came into our office, we would never touch you without x-rays, just to make sure we're doing the right thing for you, unless you're pregnant. Yep, so you come up and you give me a big bear hug, right, and you squeeze me. Well, what if, hypothetically, and we've seen this happen, there was a little tiny tumor right there in the spine, and that tumor was malignant, and now you do that, and that person's paralyzed. And that sounds pretty harsh, but this is the training we have to go through to make sure we do the right thing for you, because I really don't care. I've never been sued. That's not my concern. My concern is my conscience couldn't live with myself if I did that. So not only that, it's not real healthy if you don't know what you're doing. It'd be like a 12-year-old who's never had driving lessons getting out on the freeway. Also, if you do that a lot in the wrong area, you can create hypermobility, which is an issue with your ligaments. Now, it's an old wives' tale that causes arthritis. Because if that caused arthritis, the 85,000 chiropractors would be creating arthritis in everybody all day. And now what we know is motion in the spine not only stops arthritis, but it can reverse it. That's what the scientific literature shows on post-X-ray. So does it feel good? Absolutely. You know, and if you just a little tiny hug, you're fine. But you know how many patients we've seen that somebody just, they weren't even trying to adjust and they just got a hug too firm, and they, especially when females get over 50 and the osteopenia sets in, and they've broken a rib. And I've got a patient, she's 87, and we go to lunch about once a month, and it's a way for me to just keep her active because she doesn't have anybody else anymore. And I got her out of my pickup here just a month ago, and I don't have a side step, and I just held her, she came down, and it broke a couple ribs. I wasn't hugging her at all. I was just guiding her down. And she's had broken ribs probably 7 or 8 times in her life. And she's like, oh, yeah, we got a broken rib. I'm like, I'm so sorry. She's like, oh, it'll heal. And she comes in. I'm like, okay, how's your rib? Oh, it's getting better. So if you would do that to, you know, her, we'd break about all 12 ribs, you know. So, you know, and on the nutrition side, I've said this since we've started in practice. If just simply, and Vaughn goes into major depth of this, if our patients would stop gluten, dairy, and wheat products, we'd see half the amount of patients because there'd be so much less inflammation in the body, and the body would be in a healing process most of the time. Yep. Yeah, there we go. There we go. Sugar, that's right. That's exactly what I meant. So we got Vaughn here. We keep him around. Yeah. If you would stop gluten, dairy, and sugar, I said wheat, which is the same, gluten in the same category, we'd see half the patients that we do just because they wouldn't be in so much pain all the time. Yep.
Hi, I went to see a chiropractor for maybe 2-3 months from upper back pain, and they have these roller things that go up and down your back. After a while, that just hurt so much, but the other thing was my knees started hurting, so I quit going.
Yeah. Okay, so to give you our percentage in our office, we have a 96% success rate with the satisfaction of us and our patients. We can't help everybody. That being said, 96% is really high. Those rollers, when they go up and down your spine, if you have any arthritis in your mid-back at all, it's going to aggravate that, and it's going to create a lot of soreness, like you worked out really hard in the garden every day. And so when your spine gets out of line, so doc, just show a spine that's out of line and show it kind of changing in the mid-back, so like you're starting to arch back and the hips are out of alignment also. So biomechanically, let's think about this, and I'll kind of mirror image this. If you've got this going on, and now you've got some arthritis in your mid-back, and now your hip's off, okay, now we're starting to change that. Biomechanically, you're going to walk different. So pain can show up in another place, because even let's say you shift over and 5 pounds now goes on to one knee, one ankle, that certainly can happen. And the body's changing typically, so things do show. But we tell our patients, if you start here and you go on this path, as long as you're going that way.
Well, 3 years ago, I had a horse fall off.
Okay,
So everything from here to my hip got fractured, broken.
okay. Wow.
And they told me I wouldn't do anything.
Did they x-ray before they adjusted you? Did they take any x-rays before they did any type of adjustment?
Yeah, but the x-rays kept showing no fractures. Even when I came into the ER,
Okay.
I don't know what,
Well, you can bruise bones. They don't have to be broken.
well, they took me to surgery in the middle of the night
Okay.
because they said I had a little bleeder, and that's when they found everything in there floating.
Okay. Yeah.
It just didn't show anything.
Yeah, and that happens, and that's why sometimes they need to do extra diagnostic imaging like MRIs or CT scans, because sometimes x-rays won't show everything. So then that's when you have to look at the history of the patient. You know, why are they coming in? What's going on? How severe is it? But yeah, you know, and again, like with what you said, if there's severe things happening, you know, we would want to look, is there degeneration? You know, is that going to increase the inflammation? That could create other issues. So, you know, when the hips are misaligned, that then puts extra pressure on one knee, one ankle. It's going to also then affect the other leg because, like you said, your gait's changed. You know, you may have one step that's this much, and then your next step literally is like that. I always tease patients when they have one leg shorter than the other. I just say, you've been walking in circles, haven't you? You know, because they've got that going on. Most of them just look at me funny, but I try and have fun. So
And one comment on that, I would say, and this is not a stat in our office, my guesstimation is 10% of our patients probably get worse before they get better, because we literally are changing the structure of the spine. But if we teach you that and educate you on that, then you go, okay, my spine's changing. If we don't, you just think, oh, I'm hurting worse. I'm cruising. Yeah, I'm not doing this anymore. Yeah. So, and that can happen, you know. Jace, if I go work out with him for 3 months, the first 3 weeks, I'm going to hurt way more than when I started. I guarantee you. And if we change the workout up, I'm going to hurt even worse again. But that's part of growth. That's part of change. And a lot of it's just education. If somebody would just teach you, hey, that's okay. Let's make sure it doesn't get worse from there and change some things up, you'd be okay. Yeah.
Okay, I wore the same shoes for about 2 years, ended up with bad knee and hip pain. Finally got new shoes and inserts, but I still got hip pain. Can you talk about hip pain and what you can do for hip pain?
Sure. So the hip a lot of times affected by the low back. The nerves that come out of the low back run right out into the hip. And it doesn't always mean that your hip is the issue. So we have to analyze things top to bottom. If the hip is the issue, a lot of times, Dr. Adam, can you show what a hip misalignment looks like? So there we go. So it looks like, exactly, see how that can rotate forward? You can change your shoes, you can change your diet, you can change everything, but unless you correct that and take the pressure off, you're still going to have pain. So a lot of times we see hip issues because of rotation. This little guy won't rotate as much, but literally it rotates back and it pulls the leg up. So when it rotates back like that, it puts a lot of pressure here on that sciatic nerve. And so with continued wedging on that side for kind of molding at home or in specific adjustments, that pressure comes off.
and it also depends on where the actual hip pain is, because some people think that their hips are right here. Sometimes they think their hips are here, and so your actual hip joint, the femur joint, is right here. But you can have issues there because of what's happening here. So again, you just have to also clarify where is your hip? What are you defining as your hip? So, but yeah, again, trying to figure out what's causing it. Again, ultimately, it's about what's causing an issue, right? It's not just treating a symptom, because again, if I was just treating a symptom, I'd just go, okay, your hip's hurting, here you go, do this. Well, it's like, that's not even it. In fact, it's not even here. It's happening right here. So again, it's just determining where that's actually coming from to what could be causing it. Yeah. We have. Oh.
Okay. I've definitely had a measure of scoliosis back in here, and for a while, probably 2.5 years, I went to a Christian chiropractor in Pasadena, or near Pasadena, California, and it did help. I will say that. I think, and we took x-rays, but frankly, it got to be costly after a while. I did have some extra money at the time that I could put towards it, but how do people continue, especially if the insurance doesn't cover it, that type of thing, because I know that chiropractic work is excellent, it's good, especially if you have a good one, but to maintain something, I'm like, yeah, give me the roll here or whatever I can do on my own.
Right.
And then the second thing is, I was in Malaysia prior to coming here, and I had, and I don't know how I developed them, but like 3 herniated discs. One of them was more pronounced than the other 2. And I had a sports rehabilitation specialist work on me. He was an Indian believer, and he used kinetics, which was really interesting, like a massage, a special. And I'll tell you, that pain really left. After time, and I'm still doing some of the exercises he showed me to do. So that was really helpful. And that was, several months. But going back to that first question.
Yeah. So basically about cost of chiropractic. Once you get something corrected, how can you keep going back because of the cost? Well, for one, kinesiology it's the study of motion, how the body moves, whether it's the spine, the hips, whatever it may be, and just getting that back into place. And in fact, a lot of what we're doing when it comes to correcting the spine is about kinesiology, counterbalancing the body to allow it to naturally move back into place. Trust me, we don't do one adjustment and then make a scoliosis that's at 60 degrees go down to 40. Yeah, that would hurt just a little bit. In fact, I think that's impossible. But when it comes to cost, it's just like anything else. We always use the analogy of like braces, okay? So braces are to correct the teeth, right? And kind of that upfront cost for braces sometimes can be expensive. Sometimes it just depends on where you're going, what doctor you're at, because the costs also vary from doctor to doctor, from area to area. But the initial part of corrective care, it all depends on how severe the spine is actually out of place. But once you're done with braces, what do you usually have to wear for the rest of your life? A retainer, right? Because if you don't wear a retainer, what happens to your teeth? They move. They literally will go back. It's kind of the same concept. When it comes to corrective care, our treatment plans are different for everybody. It just depends on what's going on. But a lot of our patients, we start the majority of them off at 3 times a week. The big thing that we also do, though, is we re-x-ray our patients. Because trust me, any chiropractor can take an x-ray and treat you for that, but to truly correct the spine, you actually need to take another x-ray so you can actually see the change to make sure things are moving. And so we go through this process. When we go through that corrective care, there's an initial cost for that. But afterwards, what we call retainer care, just like a retainer after braces, sometimes just once a month. Sometimes it's less than that. So cost actually goes down substantially. And that's what we call kind of that proactive care. Because the initial correction, that's reactive care, getting it corrected and fixed. And then we move into the proactive stage. Once it's corrected and fixed, what are we going to do then to maintain that, basically, for the rest of your life? And people are like, for the rest of your life, they get scared at that word. But once you start eating healthy, how long do you want to do it? For the rest of your life, right? Once your body's healing, how long do you want that to happen? For the rest of your life. Once your nervous system's corrected, for the rest of your life. And I will say one thing about our office, and I always tell my patients that we will meet you where you're at. And people are like, well, what does that really mean? Is that we're here to help. It's, for us, it's not about your insurance, okay? It's not about your position. It's not about if you have this much money or if you have this much money. It doesn't matter to us. We're here to help you. And we want you to have the best results possible. And so when it comes to our care plans, we have a base care plan, price, package, things like that. But we really don't turn too many patients away if it comes to finances. So Dr. Shane will add.
Well, and to reiterate about the home care, one of our patients goes home with home care. So it's the kind of things that you do while you're in care with us, and then also what you do when you're not coming so much, because that keeps you there. We call it the molding phase, kind of. And so if somebody can do that and we only see them once a month, we've said this a lot. If we could just have everybody come in without any symptoms and they were all corrected and we just saw them all once a month, that would make our job really easy. Because nobody would really be in pain, they'd be corrected, but it doesn't always work that way. As long as there's life, as long as we have stress and things happen. But those things are wonderful because what they do is they keep you out of our office for a longer time, and not just our office, just any office you go to, and keep you corrected a lot longer. So it's kind of like that retainer he was saying. And as far as that goes, is meeting patients or meeting people. There's a couple patients here in the crowd tonight, and this isn't about that with us. So if you want to talk with them, when we say meet you, we're very flexible that way. And we've done a lot to give back with IHOP as far as that goes. And we just treat a lot of missionary people and have for a long time. A lot of it's our location. We're pretty close. And we treat everybody from somebody who just showed up here to people at the top all the way down. So, yeah. It was a long-winded one, we know. We could talk for 5 hours, so just cut us off if you need to. Go ahead.
Is can a person be helped if you have numbness in your hands from scoliosis and arthritis and or calcium deposits in your neck?
Yeah, 100%. And when I say 100%, that's just confidence saying that we could help you. I don't know if it's going to go away 100%. Maybe it goes away 80% and you have only 20% symptoms. Just give you one of our patients, Marcy, we started seeing her in February, March. She did a little testimonial a week ago tonight at our dinner with the doc. And we had to see her quite a bit initially. She walked into her office with her hand like this. Same thing, pain going down her arm. She thought it was going to go away after 2 weeks. She'd had the problem for about 6 months, and we kept working, and every week or two she'd see a little bit of glimpse of getting better, and now she has no pain. She got to do the testimonial last week at our dinner with the doc, and it's been a lot of fun to help her do that, but that's who she was what you explained. And how that works is the pain comes out of the neck, C5, 6, 7, and T1, and it comes down and innervates the hand and all the muscles along there. And if you guys look on your cheat sheet, one good thing about that spine chart is on the left there, it shows you all of the vertebrae that are involved. On the middle section, it shows you the areas that can be innervated, and on the right, it shows you the possible symptoms that show up. So if you're thinking right now and you're going down and you have a couple symptoms on the right-hand side there, if you have 1, 2, 10, 20 symptoms, that means you have subluxation. That means you have pressure on your nervous system, and there's dysfunction. So, good question.
May I ask how long take it for the corrective care?
Yeah, sure. Everybody's a little bit different. It depends on where you're at when you come in. Our average corrective care, and just not ours, it's just across the nation with corrective care, somewhere between 40 and 100 visits. Now, if somebody comes in, Doc, show them a major scoliosis on there. I have a patient I've been treating, Zaina. She came in with 59-degree scoliosis. She's an athlete at UMKC. She worked in our office, actually, so some of you patients know who she is. She was down to 46 degrees, so she got better. Then she got in a car accident, and it got worse. Now, show that spine, Doc, again. How much pain do you think Zaina was in? No pain. No pain. But what she was noticing as she was getting older is she couldn't run as long. She would get winded faster. Well, the compression on those nerves went right to her lungs, and so when we got her down to 46 degrees, she could run all day. She gets in a car accident, and she notices one of the major things is not pain. It was based on function, once again. So like her, we've seen her between 1 to 3 times a week for 3 years. That's a lot. But if not, she's going to surgery. At 40 degrees, that's when the orthopedic surgeon, the neurosurgeon looks at this and says, we're going to look at organ function. If it diminishes, we have to put rods in there to save the person's life. Because if not, they die. So the average care plan in our office run and just corrective care across the board is somewhere between probably 50 and 60 visits. So, yep, well, depends on how intense it has to be. It can go out to a year of care with that. Yep, depends on what's going on. Might only go 4 months though too. Depends on how intense the situation is. So.
Just add to that, because one of the, you hear of these larger visit numbers, and that can be kind of scary. People are like, 60 visits? That's a long time. But those 60 visits, we actually go through the first 40. That's actually right when we re-X-ray, is after that 40th visit. And then if, like we said, if things are correcting and moving forward, then we're actually dropping down to like twice a week or once a week. And then we're seeing how the body maintains and stabilizes from that. We may actually have to bump up again later, but we're checking subjectively and objectively how that patient is actually responding. And when we say, she's been coming in 3 times a week for 3 years, I mean, again, I use the braces analogy just because it's a good one. How long do you usually have to wear braces to straighten your teeth? Sometimes 5 years, right? Luckily, we haven't had to go that long with any of our patients. We've been able to, through the education we're taught, the continued education, we're learning how to correct the spine quicker. Corey, for example, I mean, we re-X-rayed him after 2 weeks, and he went from a forward head posture of over 3 inches, like this, to literally 1 inch, just like that, in 2 weeks. So we're getting better at this, and we're getting correction quicker. But it all depends. We get these questions a lot. It's like, well, how long is this? How long would it be for me? And to be honest with you, we don't know until we can actually see what's going on.
I've had, just for a couple weeks, like a real heaviness and dizziness and tiredness in my head, And I don't have strong prescription of glasses, but I just don't wear them a lot because didn't think I needed them. So I've put them on and I find relief. And so obviously I can go get my eyes rechecked. But I have wondered, is there adjustments where you find either that strengthen the eyes or bring adjustment to that kind of area?
So let me guess, you're on day 20 of a juice fast?
No, I'm actually not.
I'm joking. I'm joking. Absolutely. Look at the atlas for that. Atlas axis, the first two vertebrae. And, oh, there we go. Yep. See how it goes right to the eyes from the brainstem there? And we do see that happen. One of the things that we don't ask patients because it's not common, but they say, Doc, you know what? I've noticed my prescription's gotten better, which that's pretty cool. And as far as the headache, typically, do you have pain in the neck or coming up the back of your head into your?
It's not really pain. It's more dizzy, tired,
Dizzy, okay.
fatigue.
Yeah. Amy, yep. I've got a patient, Amy, I just saw her today. We've been seeing her for 4 years. She got in a car accident 15 years ago. And poor Amy, ever since that car accident, she'd had to sleep on her stomach. So when I started seeing her, 4 years ago, she was 11 years into sleeping on her stomach. And she had to create this pillow so she could sleep like this and still breathe. And her forehead has permanent wrinkles in it because when you sleep on your stomach for 11 years, that's what's created. We looked at her atlas and the curve, and she had a reverse curve of -10 degrees. And that atlas and axis goes right to your inner ear, which affects your vertigo or dizziness issues. And Amy is 90% better. Does she still have bad days? Absolutely. But she literally used to wake up and not be able to get out of bed. And now she finds herself waking up and sleeping on her side. And it took we actually had to adjust her for probably about the first 70, 80 visits seated in a chair because she couldn't lay down. She'd get too dizzy. So we've had wonderful success with that, and way better than taking a prescription that create, for dizziness. There are acupuncture points right in your wrist that you see people wear bands for that work really good for dizziness. A lot of times you see it for somebody who goes out on the ocean or travel on an airplane. And there's other acupuncture points that we use also just through electric acupuncture. It takes that much time. There's no needle involved. And it's part of the process. We don't even charge for that. So, good question. Yep.
I have one more question. After dark, I've had 10 operations on my right arm. 10. And after the car accident, I have C5, 6, and 7 fused. And I have continual nerve damage in my right arm and constant pain, carpal tunnel on both wrists. So I don't know what caused the nerve damage, if it was the fusion in my neck or the operations that they did, but can you correct the nerve damage that's if this is fused in my neck?
Good question. Again, and I just want to reiterate this, God would heal that.
Well, yeah,
Okay,
can it be fixed?
But it can be corrected. Again, with fusion, we'd have to see exactly what's going on, but I can tell you that a specific example of a patient of mine that has C5, C6, C7 fused together. Literally, we look at his x-rays. He has a metal plate actually connecting all of those. He came in because he had numbness and tingling going down into his hands. His doctors told him that this surgery would actually stop that. It actually made it worse. And we hear that all the time. And I told him, yeah, come on in. We looked at his x-rays, and I said, yeah, this is going to help. Okay? I don't know to what degree, but it's going to diminish it. He's been a patient now for 2 years. He doesn't have that anymore, numbness or tingling. Do I know if it's from the surgeries or from the neck? I can tell you that it originated probably from the neck and affected the arm. But once you start cutting in there, and depending on if they nicked the nerves or did anything like that, again, nerves can regenerate. We just have to allow them to do that. And so we'd have to look again at your spine to see what can actually be done and to what degree.
So if they moved my ulnar nerve from where it was and moved it underneath my elbow, then that would also make my hand.
Yeah.
Okay.
Yep.
Before I moved to Missouri, I went to a chiropractor in back east, and he used a little just a little machine that went up and down my spine.
Mhm.
Is that a good way to adjust the spine?
You know, a lot of chiropractors use a lot of different techniques to adjust. I can tell you that that would never correct your spine. So if we were to look at an x-ray and see that your spine was completely straight, you know, it may move the vertebra, but it will never actually correct that curvature. It's not going to allow that because you have to actually, again, add in the different rehab exercises and the therapies. You know, again, every single adjustment that we do, it's based on an x-ray. So a lot of times, depending on what's going on with your spine, we may only adjust to 2 different segments, because if we adjust more than that, it could actually create a bigger issue further on down the road. So if it helped you, I'm going to say then it was really good.
But
So-
manual adjustment is better.
Yeah,
or
you know,
more-
chiropractic,
Yes.
chiro means hand.
Hand, okay.
Okay, so we're all about manual adjustments. We also use tools in our office, though, too. I mean, there are certain things that our hands just can't do. But yes, I will always say there's something about touch that is healing. And so when it starts to get to using machines to do that, I think it's really moving away from truly what chiropractic is. Yeah.
Any more questions? Nope. I actually have one then. Migraines. What do you guys do for that? How do you, like, I got my first migraine when I was a teenager, playing football. Went to a medical doctor. Of course, their diagnosis of it was way different than a chiropractor. Like, I got 2 totally different treatments for it.
Yeah.
Like,
Yeah.
where do you guys stand on that? Because I know probably everybody knows somebody that suffers from a migraine or...
Yeah, you know, I was actually sitting in church on Sunday, and right after they were done doing worship, the guy got up and he said, well, the lady isn't able to be here today. She's sick. She's actually at home with a migraine. Unfortunately, she couldn't make it to church. And the first thing that went to my mind is, I need to see her. You know, because, you know, migraines are very, very common. He talked about that before, especially with the stressful world that we live in, the toxins that we have. But what I tell everybody is that, again, migraines, depending on where they're coming from, the first place we look at is actually C1 and C2, right there. I mean, you have your brainstem, your nervous system. Literally, that's housing that area. So signals are not only going down, but they're also going up. And so migraines can be caused due to a lot of different things. But, you know, we're always going to go straight to that nervous system. I mean, I would say 100% of our patients, I mean, have had success when it comes to manipulating the spine to relieve the pressure off of those nerves. You know, so migraines, yeah, we treat a lot of them.
You know, with a migraine, it's probably one of the most difficult things that we see because there are a lot of factors in there. But, you know, success, you know, Tom, if we told you right now, or I can't tell you because we don't know, if you had 50% success where you're at, would that be success for you? If you're 50% better in 3 months, absolutely, absolutely. So if somebody comes in and I don't get headaches. I had a headache here 2 months ago, and I'm a bad sick person. I'm not real good at that, and I kind of leave me alone type person. Anybody like that? Y'all have more grace than I do, thanks. I'm a bad sick person, and so when they come in and they say, you know, I get 4 headaches a week, well, I'm like, you get 200 headaches a year? And they go, gosh, I do, I guess, yeah. Well, now if you get 50, if you only get 1 a week, that's huge. That is a life changer. That's another 150 days you can go enjoy your family and go to work and be productive and serve and do all those things. Because anybody who's had a real bad headache before, as obviously you have, it's debilitating. You can't function. And you might be a really nice person, but you just can't express that because of how bad you hurt. And most patients have to just go lay down, shut off the lights, and wake up the next day. I always use the analogy, we used to treat a bunch of athletes, and that's what I started doing when I got out of school. Now I treat a lot more families than ever, simply because, you know, someday you're going to have kids with your new fiance, and let's say that dad all of a sudden comes home at noon and he's got a headache. Well, now he's not producing for his family. He's locked up in a room, and the kid's got to be quiet. That's way more important than somebody hitting a home run, right? That he doesn't have it's way more important that he's healthy than some guy hitting a home run tonight. at least to me. Maybe there's some people out there that don't believe that. But when it comes to migraines, a lot of times, what we see a lot of times too is migraines really not diagnosed the right way, at least 50% of the time. And I can tell you, if it's a true migraine, there's a lot of things that have to line up to say it's a migraine. And most people just have what's called a cervicogenic headache, which is a problem in the neck, creates here, comes up over the head. And when we start getting results right away in week 1, majority of the time that was a cervicogenic issue. It was just misdiagnosed, and now they're on all these meds for no reason. So, and a lot of fun because that person's got their life back. So, one of Dr. Adams' patients, we just saw them this morning. I treated her today because Dr. Adams was busy with a new patient. And it's the first time that we did this manual adjustment with a neck traction move. She hasn't had a headache since. And I ask her every time I see her because I don't treat her as often as he does. And that's just so cool. That's just so cool that her body could heal that way. She used to get a headache every day. I just can't imagine, I can't imagine. So, yep, absolutely. Great. This is by far the most educated crowd we've ever talked to. What's going on here? Vaughn, you've been teaching chiropractic stuff? What's going on?
No, he's great. You mentioned cancer earlier on, and I think probably a lot of us do know of someone. My sister has re-diagnosed with cancer. And so how do you treat that in regards to chiropractic? I don't understand. I don't understand
Absolutely.
The connection there.
He's good at this one.
When it comes to cancer treatment, especially when it comes to chiropractic, is first and foremost, when we talked earlier about the function of our body, right? And then I kind of gave the example of, we think of cancer patients as people that have a weak immune system, which they do, right? But how I kind of reverse that is I said that that's not really how it starts, okay? And it's not that they have cancer and then their immune system gets weak. It's that their immune system is weak and then they get cancer. Like my 2-year-old son, okay? I love him. He's amazing. But I also know that he has cancer cells in his body. All of us have cancer cells in our body. But are we doing the things to keep those genes turned off, or are we doing the things to turn them on? And here's the thing, if we're doing the things to turn them on, did you realize that we can actually do the things also to turn them off? And so when we look at the nervous system and how it functions, so I'm going to go directly to the immune system, because if your immune system is functioning at 100% or nearly 100%, can you develop cancer? No, you can't. Well, what controls your immune system? What controls everything in your body? Your nervous system. So if your nervous system is working and functioning and allowing your immune system to function and heal and do the things that it needs to do, are you going to develop cancer? No, you're not. And so we look at the sympathetic nervous system. We're looking at where these nerves go to our lymphatic tissue, to the organs that actually allow our bodies to have a strong immune system. We need to make sure that those are all working properly at 100% or as close to 100% as possible. And then fueling our body, eliminating things like sugar and dairy and all that stuff, that literally is creating inflammation and acidity within our body. It's a combination of these things. Because again, I'm not going to sit here and say, well, think about this. How many of you guys know that 78, or I shouldn't say 78, I got a little dyslexic there, but that 98-year-old guy, okay, that just won't die. He eats all the wrong foods. He's doing all that stuff. It's like, what is going on? It's amazing because when we see those guys in our office and we look at their spine and their x-rays, they're nearly perfect. Because their bodies can actually change that. It can heal things that we wouldn't think are even possible. But then we have a 20-year-old that comes in and they have cancer, they have, arthritis, they have all these things going on. We look at their spine and there's degeneration running through it. We have to figure out, well, what caused that degeneration, what's going on, but is their body truly healing and functioning? No. Is their immune system strong? No. And so a lot of the research that we've been teaching and going through now is actually this book. It's called The Cancer Killers. And it's a pretty bold and strong book, but it's the truth. We are becoming cancer killers. We are teaching people how to truly kill cancer. Again, cancer is a symptom. What's causing that symptom? And so through chiropractic, through nutrition, through education, it doesn't matter who has cancer. They can heal it. They can. But we're in this mindset, and we're taught by our own medical system, which is supposed to be there for what? Our benefit. Yeah, for our benefit, that this is kind of going off a little bit, but I was reading this article, and the article in this magazine said, how to respond when the doctor is telling you bad news. How to respond when the doctor is telling you bad news. Now, wouldn't this be, and just think of this, a novel idea is if our patients didn't ever come with bad news. Even if you found out that you had cancer, what if your doctor came up and said, you know what, you're not going to die from this. You're going to survive this. And then gave us the tools for that. And that's truly why we're creating this with Vaughn, with what we're teaching, is so that we can begin to do that. We live in a nation where it's chemo and radiation, or just cutting it off, right? Well, what does chemo cause? Cancer. What does radiation cause? Cancer. It's not that they're trying to kill that cancer. They're trying to kill everything and hope that you don't die, but that cancer's dead before you are. That's truly what's happening. It's funny, but it's sad. And so, and we have patients that, in my own stepfather, he had prostate cancer, okay? I get it. There's a heart that's out there. If you've dealt with it, it's a sensitive subject. But we have to stop being lied to and understand that things need to change. Things truly need to change. And that's why we stand up here and we speak about this. I don't care if I get flack for it. But again, you will not develop cancer if your immune system is functioning. And your immune system won't function unless your nervous system is allowing that process to happen.
Well, like in my sister's case, she eats well, she exercises, so we're not sure, and she did do some chemotherapy, but she was a real good patient, and the doctors were just amazed at her attitude. So, but now after several years, she's had a reoccurrence, and it's a slightly different area. So, anyway, but she eats well. Maybe she could be eating a little bit better, and she exercises and stuff. So that's a little bit of a puzzle.
Sure. So, chemo, eat better. Was the cause of her cancer ever corrected? Or did they just mask the symptoms? Right? So, we can do chemo, we can do radiation, and what happens? The cancer cells aren't as measurable, they're lower. But the cause of why we have it is still there. So what shows up within 5 years? It shows up again. It's that way for a lot of things. Our friend Chuck Majors, our other friend, Coach Ben Lerner, wrote a book, some of you might have read it, called Body by God. Chuck is soon to be 40 years old. Here 2 years ago, was having headaches to the point where he'd just pass out. And he's the last person on this planet that I would think would see a medical doctor. And he finally said, I'm going to go see what's going on. Had an MRI. They found 4 tumors on his brainstem. They didn't think it was malignant at the time. They went in there and they opened him up. This is in Chicago. They found out at the time that he had cancer. They closed him back up and said, we're so sorry. We're going to start with chemo and radiation. And he just said, no, we're not. He laid there for 2 weeks, $380,000 later, to open him up and close him and let him lay there for 3 weeks, of which he lost his voice because of the trach tube that went down, scarred his vocal cords. In the story in here is he hopped on a plane 2 weeks later with his wife with shunts coming out the back of his occiput right here. Flew out to Salt Lake City, went through treatments just like some of what Vaughn does, some things that we do, some things that other people do. He went to the specialist of the specialists in the world to do this. It spells it out what he did here. Now, Chuck had the means to pay for all that. Chuck also knew he wasn't going to die. Okay, you got 4 brain tumors on your brainstem. They're cancerous. They open you up and they say, sorry, we can't help you. Chuck now wrote a book to prove to you what you can do, right? It's only 100 pages long. Is it controversial? Oh my gosh. Are they going to get some flack? Absolutely. But is it the truth? Absolutely. He wrote this book and he will lose money writing this book, no matter how many, unless there's 1 million copies sold. Writing a book costs a lot of money. Found that out. And he doesn't make $1 really if you go do medication. So there's no malice behind any of this besides him wanting to serve and help. And it's 100 pages, it's simple, it's easy, and it's the truth. The truth always takes less words, right? On page 98, it was his daily regimen of what he did. And so now he teaches the world how to help fight cancer without drugs and medication. So, right there. Yep. There you go. Take it. Give it to your sister. You read it first. Yeah. Yep. It's a great one. It's simple. I'm not a huge reader. I've always read to memorize everything all my life. That one, picked it up, read it, and it's a friend of ours, so had a little more meaning, you know. And Chuck, I'm sorry?
You ordered online?
I don't know. Yeah, it's $25 in our office. Yep. Save you the shipping and handling. We're just off state line, so close and easy. But just great information. And it's the same, you know, I'm going to guess 25 or 30% of what Vaughn teaches you. And there's things in there that Vaughn or ourselves we don't do that are very beneficial to the body in these situations. And, you know, bottom line, guys, is we always talk about insurance. And your insurance doesn't care about you. If you have cancer, they actually don't like you because you're going to cost them a lot of money. And if you spend too much, what do? They drop you, okay? So start paying for things that create health. When we wait for things to show up, you're waiting for your insurance to take care of the disease. So, yeah, so to answer your question, her cancer, the cause of her cancer still wasn't figured out yet. That's all. That's why it came back. Great. Wonderful, guys. We good?
Okay.
Well, thank you guys so much. Yeah, thank you.
Thank you,
For
guys.
everything. Wonderful. Appreciate it. 8:23. We've got an issue with talking. We can just go and go and go. So.
We're good listeners.
Great listeners. Thanks, Jace. Yeah, appreciate
Yeah,
it.
thank you, guys.
Yeah, thank you. Thank you.